What is blood pressure? It's a commonly asked question. When the heart pumps blood into the various organs of the body, the heart pumps and raises the pressure in the blood tubes of the body. It's the blood that produces pressure on the walls of the blood tubes, and that is what we call as the blood pressure. When the heart pumps, the pressure in the blood tube rises to 120 millimeters of mercury. When the heart rests, it comes down to 80 millimeters of mercury. That's what we call as a normal blood pressure, 120 by 80. When the blood pressure rises to high levels, you call it as high blood pressure or hypertension. Systemic hypertension is the correct word. Systemic hypertension, unfortunately, can damage every organ in the body. To start with, can damage the brain, producing paralysis on one side of the body. Can damage the heart, thickening of the heart muscles, and gradual weakness of the heart muscle is a result of prolonged rise of blood pressure. Can damage the kidneys with gradual deterioration of kidney function. Can thicken the blood tubes and produce block to the blood tubes. That's what produces the heart attacks as well as the what we call as the brain attack or the stroke. So blood pressure is something to be feared at. But blood pressure is something which could be identified earlier and which could prevent a lot of its complications by controlling the blood pressure and keeping it within normal limits. Why do this occur, people ask? If your family has high blood pressure, father and mother has high blood pressure, always remember there is a genetic link. The children do have a high tendency to develop blood pressure. Often by the time they reach 40 or 50 or 60. When the blood pressure rises in a given individual depends upon the stress and strain that individual goes through psychologically. But more than the stress and the strain, overweight, increased salt intake, lack of exercise, tobacco use, all this brings about high blood pressure. All of them produces spasm of the blood tubes and raises the blood pressure. So in short, it could be a genetic disease, but more than that, it's your abnormal lifestyle which brings in high blood pressure in your state, in your condition.